We're live. Go ahead.
Welcome everyone to the COVIDcommunityresources.com town hall meeting powered by the Center for Closing the Health Gap. We're going to get personal today and talk about the impact of COVID-19 on our relationships and our mental health. Members of the Cincinnati Association of Black Psychologists are going to talk about intimate relationships, parenting young children, teens, and young adults during this pandemic. We're going to talk about remote schooling, how to cope, when to seek help, and substance abuse. We have a lot to talk about. So I'm your moderator, Cincinnati City Council member Jan Michelle Lemon-Kearney. Let me give you a few quick housekeeping items. First of all, I have to always thank our wonderful producers and tech team, Renee Mahaffey-Harris, President and CEO of the Center for Closing the Health Gap, and the center makes all of this possible. John Reichel, our tech guru, Lauren Harden of the Health Gap, who is on Facebook, making sure your Facebook questions get to us. Also, Renee's daughter, Sloan, John's daughter, Maddie, and my daughter, Celeste. We have a big team making this all possible. So if you're on Zoom, please put your questions in the Q&A. And if you're on Facebook, just enter your questions in the chat and we'll get them. And note that we are recording the town hall sessions so we can repost them later. Okay, let's do some quick introductions for today's panelists. And they are from the Cincinnati Association of Black Psychologists. We have Dr. Ritchie Hall, who is coordinator of substance abuse services at Miami University Counseling Center, and he is the president of the Cincinnati Association of Black Psychologists. We have Ms. Gwen Parrott, who is a school psychologist, Dr. Randy Balu, who's a senior research associate with Philliber Research Associates, Dr. Anna Ghee, Associate Professor, School of Psychology, Xavier University, Dr. Adam Evans, who is a psychologist, Dr. Miska Prater, who's a therapist at A Sound Mind Counseling, and Dr. Kathy Burlew, who is Professor Emeritus of Psychology at the University of Cincinnati. And I think I got everybody. Did I miss anybody? We have just a jam-packed, powerful, powerful panel today. So we're going to do this a little differently this week. Usually we do quick introductions, the panelists say a word or two, and then we start doing questions, but we want them to really give you some information on their topics. So I'm going to call each panelist and they're going to take a few minutes, a few extra minutes at this point to actually give you some jam-packed information. So sit back with your cup of coffee, your tea, your glass of wine, whatever. Pay attention and listen. And after they're all finished, we will do Q&A, okay? So let's start with Dr. Ritchie Hall to lead us off. Dr. Hall, take it away.
Hello, my name is Dr. Rich Hall, and as you said, I am the president of the Association of Black Psychologists, an organization that's main job is promoting and advancing the profession of psychology for African Americans. So we're very glad to be here. We also wanted to say our thoughts and prayers are for those out there who are essential, who are working, providing services to people involved in healthcare, and in other ways in which so many people have been affected by this. And so we wanted to make sure that we were being thoughtful of them as we speak today. My topic that I typically work with is young adults. As you might have heard, I am the coordinator of substance abuse services at the Miami University Student Counseling Center. So I work with young people who are very much affected by COVID, a lot of college students who had to return home in the middle of their college experience, a lot of seniors who find themselves on the cusp of graduation, who've now seen their lives very much disrupted, a lot of family members now having to deal with teenagers and young adults in the home in a capacity that they might not have been before. They might have merely been visiting briefly and for holidays and summers, and now people are together for what has been a couple of months and looking to be together for even longer. So some of the information that I provide is the importance of structure, the importance of open communication, and the importance of making sure that during this time, which is stressful for everyone just tries to keep open communication, keeps themselves focused on, you know, what people still have responsibilities, they still have duties, students are still in school. So there's a lot going on in the families right now. And it becomes very important that we extend a lot of grace to each other and make sure that we are understanding as best we can be as people are trapped in homes with each other. And like I said, so many people having so much disrupted right now. And so that ends up being kind of the focus of the practice that I see every day and the types of people that I work with. So some of what I'd like to continue talking about when we come back around to the Q&A is how do we maintain those structures, maintaining good sleep schedules? How do we continue to sort of celebrate some of the big milestones that are still happening, even though these changes have occurred? And how do we keep our mental health in check when there is so much uncertainty for young people? And so with that, I'll pass it to the next moderator.
Thank you. Thank you so much, Dr. Hall. I know we're going to have a lot of questions around those topics. Next, we're going to talk to Ms. Gwen Parrott, who's a psychologist, and she is going to talk about remote schooling during the COVID.
Yes, thank you. Our COVID-19 not only changed the way schooling and instruction was being provided, but it also changed our daily lives. And in crisis, we are forced to adapt to these new norms and establish new norms. But was the normal that we lived prior to COVID normal for us as African Americans? And are these disparities normal that exist in our healthcare system and our health, our use of technology, our housing, workplace finances, and our education systems? And these disparities definitely have an adverse impact on our communities for generations to come. So will these disparities continue? Will they improve, or will they remain the same, or even worse with these norms? The better our children are prepared educationally, and that's the 3 hours reading, writing, arithmetic, and even better with good critical skills and a good sense of who they are, the better we will be able to close these gaps for future generations. Distant learning did demand a lot from parents and teachers, as this was the first times that many schools were forced to seek alternative ways to provide education. And there were some challenges, a lot of frustrations on all parties at first, but as time progressed, teachers, parents, and children were able to adopt or adapt to these new norms. What did not change was the continuation of this digital disparity as it impacts our children. And having access to technology is vitally needed in the educational curriculum during this pandemic. And it was even before COVID-19, and it will be long after. There are some potential long-term effects of COVID as it relates to schooling. And we saw this with Hurricane Katrina. The schools will make probably greater use of online instruction, and the digital divide will continue to be a concern. There may be a shift from charter schools because of less regulations. The roles of students and parents and teachers may change. The politics of education and schooling may change. But plans are being made to speak, reshaping the look of schooling come the beginning of the school year as we speak. And we may need to consider things like, will this new model be safe? Will the needs of the parents who have to work be considered? And will all students have access to the technology needed? Because all students are included. And we're talking about students with special needs, students that are homeless, as well as students in foster settings. There is, Kujichagulia is one of the second principles of the Nguzo Saba, which means 7 principles. And it's rooted, the Nguzo Saba is rooted in our African tradition and culture. And it's the foundation on which Kwanzaa was created by Dr. Maulana Karenga in 1966. And the overriding theme that flows throughout that principle, or all the principle, is an emphasis on the collective effort and the collective will to strengthen our families and our communities, and to take and have more control over our daily lives and our destiny as a people. The principle means self-determination. It means that we define ourselves, name ourselves, create for ourselves, and speak for ourselves. So I urge us to look at reshaping our schools to address these disparities, because our future really depends on it. So let's be proactive. We're going to need to expand our mindset and maybe talk about this a little later.
Thank you so much, Ms. Parham. I was going to say, I love the fact that you're bringing up Kwanzaa and the 7 principles, just to remind us that these are principles by which we can live our lives every day, not just during the Kwanzaa season, you know, December to January 1st. So I think that is wonderful. Thank you for reminding us. I love the principle of self-determination, Kuja Chagalia, really important that we think about that, especially now. And that's really why this COVID-19 communityresources.com was founded, because we said we've got to save ourselves. We can't just sit back and wait. So thank you so much for reminding us about that really important principle. So next we're going to go to Dr. Randy Balu, and Dr. Randy Balu is going to talk about teens and young adults. I've got both right here at home. So thank you, Dr. Burlew.
Thank you for having me. I actually want to talk a little bit about parenting, particularly young children during the quarantine. Many parents are in the position now where they're working full-time from home and at the same time have the responsibility for managing their children's full-time education. So on top of that, we've also been stuck at home together for the past few months, which is stressful in and of itself. So it's important to realize that this is a really stressful situation for everybody involved, and it's having an impact on family dynamics and relationships. In fact, a recent study out of the University of Michigan found that a majority of parents report that the isolation and economic stress from this pandemic are impacting their parenting. And this sometimes manifests itself in the form of yelling, screaming, and spanking more than usual. So I'll offer just a few suggestions to help parents cope with these new circumstances. First, as Dr. Hall said, give yourself some grace. And don't forget to attend to your own well-being. We're in the middle of a crisis, and the demands on parents as working people and as leaders of their families have increased exponentially. So this is definitely not a time to ignore your own needs for rest, relaxation, and support. Second, help your children understand their feelings. Disruption in normal routines and anxiety from outside threats can sometimes lead to anxiety and depression in young children. And so young children especially might be experiencing anxiety about the situation and not fully understand what's happening. So as parents, we want to validate their experiences and let them know what we can do as a family to keep ourselves safe, like washing our hands and staying at home. And we also want to give them opportunities to talk about their feelings and acknowledge the stress that they're experiencing. The third thing I want to say is that you really want to help your children stay connected. And so in addition to using technology like Zoom and FaceTime to help your children stay connected to friends in school, use that same technology to help them form deeper connections with family, elders, and their culture. So if you're looking for activities for your children to work on, think about Afrocentric activities, like having them work with their elders or members of their families to understand their family history or to understand the history of African Americans, or have them learn more about the 7 principles of the Nguzo Saba. Fourth, I want to say kids thrive with routine and structure. And so as the principle NIA or purpose reminds us, having goals for the day is a good thing for kids and for adults. So the routine doesn't have to look like your typical school day or your typical summer camp day. And you can even work with your kids to find a schedule that works for everybody in the family. And I'll just say it took my family about 3 weeks to come up with a schedule that worked for everyone so that the parents could get work done and the schoolwork could get done too, and we could all still end the day loving each other. Finally, I just want to say, consistent with the principle of Ujima or collective responsibility, have your family work together to come up with a plan for how you're going to make it through this pandemic. Everyone in the family, including young children, has a role to play. And that ranges from treating each other with kindness and respect to everyone pitching in to make sure all the chores get done. So I'll stop there from now, and hopefully we can talk more about this during the Q&A.
Thank you so much. You hit on a lot of good points, and already I can see questions coming up about dealing with anxiety and further integrating those 7 principles into our daily lives. So we've got a lot to talk about. Okay, so next we're going to go to Dr. Anna Ghee, and Dr. Ghee is going to talk about intimate relationships. That's how is COVID affecting our relationships? Dr. G, thank you so much.
Hi, I'm actually going to focus on protecting our mental health during this pandemic through intimate
Okay, I got everybody's
relationships.
thing wrong. I'm sorry. We're good. Okay, good. Okay, so tell us again your topic. That's great.
Okay. Intimate relationships with ourselves and with others, and I'll define that. I'm going to be focusing on a couple of goals and a few strategies. The first goal is to strengthen your relationship with yourself. This is what I call me time, but me time with purpose, or NIA. Me time is doing things for yourself and by yourself to protect yourself. I have 5 strategies. The 5 S's: self-care, slowing down, soul searching, setting goals, and spiritual enrichment. Self-care, this includes the many things we do to stay healthy and fit during this pandemic. Examples of self-care we know are wearing our mask, covering our mouth and nose, making sure that we wash our hands frequently, the physical distancing. So all those things that we need to do, wear gloves and drink plenty of water. And then slowing down, number 2, is a great way to recover after we've experienced a heightened stress and anxiety, especially during these chaotic times. Find creative ways to relax and slow down, or there could be consequences of headaches to high blood pressure, even panic attacks. Number 3, soul searching. Take time to do an honest assessment of what's going on in your life and what's important to you. It takes patience and courage to truthfully face what you see in relationship to how you're dealing with this COVID-19. And then setting goals. Think about how to become a better version of yourself. In this spirit of NIA, or purpose, our highest goals are to improve ourselves, but also to benefit others. So setting goals is especially important now because we all need hope, the hope that there's a better day ahead of us. And then number 5, in the spirit of Imani, faith, spiritual enrichment is when we take time, for example, to meditate, to pray, to focus on gratitude, peace, and love, and appreciate those who are still here with us, as well as respecting and honoring those who have gone on. Now, all 5 of these me time strategies work together. They make us stronger inside so that we can face the world outside. But in addition to me time, I also want to say that it's important to have what I call we time, but we time with unity. This goal says that we spend time in relationship with others, that time that recharges us, because we can be ourselves with certain people that we need to intentionally think about who they are. And they may be a friend, a relative, a spouse, a girlfriend, boyfriend, a sister friend, or bro. But especially during the physical isolation in this pandemic, we really need more and more me time, and me time with we time in unity. We time in unity is time that we spend, again, sharing and giving back in return, because both of you and all of you get stronger together. In light of the tragedies and risk, and knowing that Black people are dying and more than any other people from this virus, knowing that Black people still remain the targets of racism and discrimination every day, that we time is now important more than ever. And I'm just going to try to quickly say that I have these, I did a survey in conjunction with the Black Couples Getaway Academy. We recently just surveyed 100 Black couples, and who said that their relationships were stronger since the pandemic. And I'm going to cover just the top reasons. One was realizing that tomorrow is not promised, so appreciating what we have. The other is spending more time together doing simple things, staying in touch with family and friends, such as having fun, quality time with our kids, and using technology for staying connected with friends and extended family. Then prayer circles, praying together. A lot of comments about doing charity, doing prayerful service, sharing responsibilities, generously doing something that other people want and need. And then I'm going to end this with just two more quickly, doing things that bring much needed laughter. So to balance out all this loss and sorrow, and then making a commitment to come out of this better than we went in. And that's something we all can do.
Oh, thank you, Dr. G. And you know, that's an ongoing theme, to come out better, individually, as a community, to get through this crisis and not just survive it, but to thrive. Let's come out better at the other end. And I love the way you were talking about couples getting closer. Dr. Balu talked about families getting closer and parents and children. So we are going to come out better. And so thank you so much for that. Okay, so next we have Dr. Adam Evans. And Dr. Evans is going to talk about when to seek professional help. Dr. Evans.
Good afternoon to the viewers and listeners of this podcast. I'd like to talk about another critical component, and I'd like to speak about when to seek psychotherapy, or as you say, talk therapy. I believe I have 3 minutes, so I will be brief, and I will cover the 9 signs or red flags and the corresponding symptoms.
Okay.
Number 1 is increased stress. Some things that can lead to increased stress is consumption of news shows, platforms, of the coverage of coronavirus, new cases and death rates, etc., homeschooling your children, unemployment, layoffs, reduction of work hours, less income, lack of workplace safety, concerns about loved ones, family and friends, overcrowdedness, and lack of privacy. These stressors can lead to headaches, migraines, irritability, difficulty sleeping at night, changes in appetite, difficulty concentrating, and difficulty remembering things. Number 2, feelings of sadness and decreased motivation. Symptoms might include hopelessness, thoughts or feelings of suicide, homicide, loss of interest in things that you used to enjoy, and receiving less pleasure from the things you used to enjoy. Lastly, difficulty coping and increased crying. Number 3, excessive anxiety. You may experience racing thoughts, ruminating thoughts, difficulty falling and staying asleep. Number 4, trauma and abuse. Being triggered by occurrences in your environment, experiencing ongoing or increased abuse. Number 5, relationship instability. Feeling unfulfilled, poor communication, increased conflict. Number 6, adjustment difficulties. Difficulties moving on, resulting in lingering grief. Those might include loss of a job or loss of a loved one from COVID and or other things. Number 7, increased substance and alcohol use and abuse as a way of attempting to cope. Examples can include sex addiction, an eating disorder, and gambling addiction. Number 8, obsessive thoughts and compulsive behaviors. Excessive and repetitive thoughts and behaviors. Examples might include excessive hand washing, counting, and checking behaviors. And lastly, number 9, children excessively acting out. For example, misbehaving, disobeying your directions, and or fighting. If you are experiencing any of these symptoms, I highly encourage you to seek out a psychologist or therapist, and you may do that through your insurance provider.
Thank you so much, Dr. Evans. And I was going to say those tips are things we can look for in ourselves, but also loved ones too. And so they give us kind of a guideline for, for when it's beyond just feeling stressed and anxious to, okay, we need professional help. And there's no shame in that. I mean, the shame is not getting the help when you need it. So let's make sure, we're all thinking about that so that we all stay healthy and or get healthy. Okay, so thank you so much. Next, we're going to have Dr. Miska Prater, and Dr. Prater is going to talk about emotional health and coping. Thank you, Dr. Prater.
Thanks. Hi, everybody. So I just wanted to talk about some ways to cope with everything that's going on at this point. Not only is self-care something we should be doing anyway, but it is absolutely mandatory. So I just wanted to share a couple of tips with you about things that I've been suggesting to clients through this time. including journaling, writing things down. If you're feeling overwhelmed, not knowing what to do, sometimes writing those things down either in a journal or in the notes app on your phone or whatever the case may be can sometimes ease some of that pressure that you're feeling. Also, reaching out for support. So we are a community-oriented culture, and it's important that we maintain that through this time. So if you're feeling down or overwhelmed or experiencing any of the symptoms that have been mentioned before, at this point, we have all become very familiar with the Zoom, FaceTime, whatever you need to do in order to reach out to someone, because not only will that help you to feel better, that also ensures that our community is cared for and looked after. So I encourage you to, contact someone who may not have as much interaction with people, see if they need anything, see how they're doing, and that way that can kind of boost up the collective feeling of okayness during this time. Also, move your body, going for walks. Sometimes it's too cold lately to do that, but going for a walk, or either if you're in the house, particularly if you're stuck with your family or children, this is an opportune time to get some music going, dancing. This is a time to kind of let your kids know about your history and your music and the type of entertainment that you're into, and they can do the same as well and teach you some of their new dances and music and things like that. So that's another recommendation. Also, this one is very important. That is really to limit your intake of news media at this time. It is overwhelming, and that is going to continue to spike your anxiety if you constantly just leave the TV on the news all day, every day. So I would encourage people to maybe pick 2, maybe 3 times a day to kind of check in, because it is important to stay informed, but it is not necessary, and it's not going to be beneficial to your mental health or your anxiety to kind of keep that on a rolling ticker all day. And then finally, try to get some rest. I know it's very difficult during this time. However, it's important that we keep our immune systems intact as much as possible. Should you become sick, we want you to be able to have all the internal tools available to you to fight off the virus. So it's going to be important that you get as much rest as possible.
Thank you. Those are really, really good points. And what I'm hearing from everybody, it sounds like we're talking about taking care of our physical health, and that helps us take care of our mental health as well. So we have to keep in mind, like you're saying, the rest and, and the exercise, eating well, that kind of thing. And so those are all, it sounds like those are all really important in terms of our mental health too. And I love that Dr. Adams gave some things or Dr. Evans, gave a list of things to look out for. And one of them was substance abuse, really drinking too much, maybe using other substances. So we're going to move to Dr. Kathy Burlew, who's going to talk more about substance abuse. Dr. Burlew.
Good afternoon, everybody. I consult at a substance abuse clinic, so I want to spend a few minutes talking about substance use. So if you have experienced a substance use problem, I'm talking to you because you know that recovery from substance use is very hard, even under ordinary situations. So when we add the stress of the pandemic and the social isolation of the pandemic, we're adding additional risk factors. So if you're in treatment, we encourage you to stay in treatment. Substance abuse treatment centers are considered essential services, and so they're open and they're providing online, remote, and on-site services, so you can stay in your treatment. But the research shows that about half of the people who have been in treatment have some kind of relapse afterwards. So I have 3 tips that might be helpful to make sure that you are part of that group who do not relapse after treatment. The first tip is kind of based on the African proverb, it takes a village. You're familiar with that. And that is to use your social support network, reach out and connect to people during this time. people who can be helpful to you. Both your professional and your personal relationships are important during this time. The second tip, and I'll use the term Sankofa to illustrate the second tip. Sankofa means there's nothing wrong with learning from hindsight. And so here we're talking about knowing yourself and responding to your personal warning signs from the past. And that's what we mean when we say learning from hindsight. So your response when you experience one of those warning signs might be as simple as self-care, where someone earlier mentioned journaling. You might journal about what was it like before. Remember that other time when you thought you had everything under control and you used, and then you lost your family and your house and your job? That's part of self-care, but also another part of self-care might be what Dr. Prater was talking about, and that is engaging in activities that distract you, like dancing and exercise and meaningful activities. And the other part of knowing yourself is knowing when you might need additional support, more than you can give to yourself. And if you experience a relapse, knowing how to keep the lapse from turning, if you experience a lapse, knowing how to keep the lapse from turning into a full-blown relapse. And there's services out, resources out in the community that you might call on at that time: NA, AA, connecting to a sponsor, or even returning to treatment. My third and final tip is to strengthen your recovery capital. What do we mean by recovery capital? Research shows that along with social support, other factors increase the likelihood of abstinence. Some of these factors are engaging in meaningful activities, and it could be work, but there are other meaningful activities as well, but also securing adequate and stable housing and just being safe. All of those are tools that might help get you through this pandemic without having a relapse. So we have a list of NA and AA services that are available remotely and on the telephone during the pandemic, and I'll make sure that those get posted on the website. I'll end with that.
Thank you so much, Dr. Burlew. So we have a lot of information. We have all these wonderful experts on. Those of you listening in on Zoom or Facebook, it's your turn now to ask questions. We already have some that have started to come in. So let me start. I'll just start at the top. This one is for Dr. Hall, Dr. Ritchie Hall. And this is a great question. How important is it to celebrate milestones, graduations, anniversaries, those kinds of things during this time?
I'll say that it's actually very important. That's one of the hardest things that families are struggling with. I mean, they've spent so much time trying to get their young student, their young child across the threshold of graduation. And this year, so many of those milestones just have to be altered. And so it becomes very important that something be done around the home that helps the student, the young person, to understand how important it is that they've made these changes and that they've achieved these things. So it becomes very valuable that as a family, as much as you can, people get together or be it through Zoom, through non-traditional means, be it, I've seen a lot of videos of people doing like drive-bys, honking and waving, enlisting people from the neighborhood. It's still that while they're struggling with this being removed from, this opportunity to celebrate in traditional means, that you work hard to find other ways to let them know that you still value that they've gotten this far, that there's still more to go, even in the midst of all this uncertainty. There are still, for those who are going off to college, those who are ending college, moving to their careers, as they go through these transitions, it's still important that these milestones be treated as valuable and celebrated in whatever way we can, just so that there is some semblance of normalcy as people deal with all this change.
Thank you so much. I appreciate that. That's so important, as you said, that we find ways of celebrating, because people have made great accomplishments, and we want to make sure we don't let that just go by. Here's a very specific question for Dr. Adam Evans, and it's: are the risks for contracting COVID-19 greater for individuals living with HIV/AIDS?
Actually, findings currently have found that those who are living with HIV and AIDS, they're not testing at high rates for COVID, and most who have tested as positive for COVID are doing well. Those on antiretroviral treatment who have an undetectable viral load and adequate CD4 or T cell counts tend to do well. However, the risk of severe COVID-19 symptoms increases with age, as many individuals living with HIV and are over the age of 50 tend to have underlying health conditions associated with worse outcomes. For example, chronic lung disease, cardiovascular disease, diabetes, high blood pressure. These individuals are also more likely to smoke. However, their risks are not so much related to HIV status within itself. And although these signs are well for those living with HIV and AIDS, I do encourage that you do practice physical distancing and wearing your mask when appropriate, when out in public, and just taking care of yourself.
Okay, thank you very much. And I noticed you said physical distancing, because we've been calling it social distancing, and I hear there's some concern that we switch and we start saying physical, not social. Does anybody want to comment on that? And that's another question, actually.
I think that it's important to differentiate physical distance from social distance. And it's acknowledging the virus's malignant ability to be transmitted from person to person, but also acknowledges that the virus has no power over our ability to support and nurture one another in this time of extraordinary threat. I'd like you to think about the power of isolation in society. Solitary confinement is considered the worst punishment a human can receive. In fact, most civilized communities consider it a form of torture. So we should move away from saying social isolation to actually what we mean, which is physical distancing and reaching out to those around us. The best thing that we can do is to call our loved ones or next door neighbors or elderly or cousins or family members who may live alone, and just to inquire how they're doing. And it doesn't take that much time to do that.
And that's another way that we can all get closer. While physical distancing, we can get psychologically closer. We can strengthen those bonds. So that's really good. For Dr. Anna G, this one is about couples who live separately. How do they keep their relationship together during this time?
Thank you. Well, fortunately, there is something good about these times to say, and that is that we have technology that really helps us with communication. And so whether it's couples who are separated or it's individuals who aren't partnered but are separated, in both of those instances, as Dr. Evans mentioned, the need for social contact, the need for touch, for intimacy, that's just part of our human nature. We are social beings and we are interdependent beings. We need each other. And even though we're used to physical contact during this distancing period of time, we may not be able to have that, but we still have ways to express our affection for others. And it's really important that we use every way that we can to be able to touch when we can't touch physically.
Yeah, sometimes it's just picking up the phone and calling that person and just checking in on them, right? I see Dr. Randy Balu shaking her head. Randy, did you want to jump in on that one?
Yeah, I think it's important for couples that are physically in the same place and couples that are separate to do those sorts of things. So it's still important to date. It's still important to have romance. We just have to find new ways of doing it that respects the laws of physical distancing. But staying connected emotionally is just really important during this time. And one of the things that I say to families is think about what type of relationships you want to have at the end of this. And we've got to nurture and cultivate that during this pandemic so that when we come out on the other side, we still have the relationships that we want.
Wonderful.
And I'm going to just quickly add that we've been talking about principles of Nguza Saba, and the principle of Kaumba, creativity, is something that we can use to our advantage. There's many ways to keep our friendships alive, to keep our intimate relationships alive by using our Kaumba and using our technology.
So, so we all need to get out our Kwanzaa handbooks and go back over these principles and, dust them off from January 1st when we probably put them away, and start looking at them as a way of living our daily lives, right? I mean, you all have really shown that we need to incorporate these principles into everyday life. And I think that's just a great lesson. Ms. Parham, now here's a specific question about education. And it says, what can a parent do if special education services aren't being provided by distance learning? Ms. Parham, your mic isn't on. Sorry, you have to unmute. Yeah. There we go. Okay, here we go.
Thank you. That's a really great question, because one of the biggest frustrations in providing instruction or distant learning during this time for teachers was communication. So regular collaboration between the parents and the teacher is really, really important. And I know this is a time when people don't necessarily answer their phones because they don't recognize the numbers, but that's really critical at this point, that you answer the phone if you don't recognize the number. But your question regarding if a child that receives special education does not receive the services within the time frame, because it's important, is legally an individualized education program is a binding document, legally binding document. So if the services are not being provided, there are compensatory services that have to be provided to make up for the time or the instruction that was not provided. And how that can be done, again, we have to use our Kuumba, because we can't have necessarily, we can't come together to provide those services as they are normally provided in a school setting. And so they can be done, and a lot has been done technologically, but compensatory services are due.
So we encourage parents to pick up the phone, call the teacher, call the principal, call the counselor, because everybody's working. I mean, no one's on vacation right now. And I think sometimes people think because everyone's at home, but the teachers are still working. They're still on duty. They're on call. So make sure we pick up the phone and call them.
Yeah, that's correct. And I find that teachers are really flexible, and they really work with parents regarding when they're available in their time, even sometimes in the evenings.
Okay, that's great. Dr. Prater, a question for you. What do we do if we just can't manage our stress? All this just becomes too overwhelming.
It can be hard. I recommend, of course, if you're feeling like it's too much and you can't manage your emotions, to absolutely contact a professional. However, there are a few other things that you can do. I know there's a lot going around on the internet about different ways to kind of cope. And I think it's important to try a variety of things as well. So if you tried yoga and that's not your vibe, that's okay. We can try meditation. If that doesn't work for you, we can try something else. So I do think it's important to make sure that you expose yourself to a variety of things, just because sometimes we feel like, oh, I tried this like one time and I could only meditate for 15 seconds. That means that this is not for me. So just kind of familiarizing yourself with different ways of self-care and trying things until you find what is going to work for you and what your needs are. And if you're still feeling overwhelmed or like you can't manage it yourself, by all means, contact a professional who can hopefully give you some assistance.
Okay, thank you so much. So this question is for Dr. Burlew. It's from an anonymous attendee, which is fine. Attendees, if you don't want to give your name, don't feel like you have to, okay? So this one says, can recreational drug and alcohol use help during this time? And I hear recreational use is up. So that's the question, and a good, honest question.
I think recreational alcohol use has its place and can be safe, but the important thing is not to fool yourself into believing that you're just using drugs or alcohol recreationally when actually you're overdoing it. And online, there are some quizzes that you can take that let you know whether you are overdoing it. So if you think you're using every day, starting to rely on it, if you're missing activities, if you're starting to feel bad when you don't have access to the substances, it might be time to take one of those quizzes online just to see if something's going on, or to contact a professional to help you decide whether you have a problem or not. I also wanted to say that there are some triggers that sometimes actually threaten your use, threaten to make you use more than you should use. And you probably, again, part of knowing yourself is knowing what those triggers are. Sometimes those triggers are people, sometimes those triggers are places or situations or moods. And so being aware of your triggers is a good idea as well. And then thinking ahead of how to manage those triggers. If your triggers are people or places, then it's not like, and they're at your job site, you can't just say, I'm gonna manage those by not going to work. You have to figure out a way of actually dealing with the stressors that you might face when you encounter those people or when you're at the work setting.
Okay, thank you so much. Now, there are 3 questions here that are really similar. So attendees, forgive me for combining them all, but they all have to do with the availability of mental health. I have to take off my glasses so I can actually read them. So I'm going to give them all together. One is, how can one get mental health help when we're under a stay-at-home order, which is similar to another question that says, are the clinics, substance abuse and therapy clinics, even open? And then the third one that's related to that is, how do you get in touch with a therapist, and is it expensive? So any of you can answer that and just combine them all together. So availability of therapy, can we actually go in person? How does that work? How do we find a therapist, and is it expensive?
I'll share that right now, most therapists in the city of Cincinnati and probably the state of Ohio and nationwide are doing what we call telehealth. And this involves being able to visually see the client as well as hear, just as we're participating in this Zoom platform. The next step would be to call your insurance provider, whoever that is that you have. You can give them specifics if you prefer to work with a particular gender, if you prefer to work with a particular ethnicity or a particular age. Right now, I know that several of the mental health carriers are offering a waiver of the copay, and this is just to ensure that those who really truly need therapy are able to access it. So the process is very simple in that you're just calling your insurance provider and then, letting them know what your preferences are.
I'll just add to that. There was a question about substance use. Yes, the substance use clinics are open, and they, like Dr. Evans was saying, they're offering both remote and on-site treatment. So you don't have to wait until the pandemic is over to seek treatment for your substance use. And at the end, I want to show you, we have a list. I think Renee will help me show a list of some services that might be available at lower cost for you.
Okay, Dr. Burlew, I'm not sure if we were able to get the screen sharing part. Why don't you go ahead and tell us about those resources?
Okay, well, what I'll put on the website are some emergency services that are available, at 24 hours for you to actually, if you want to talk to somebody and you're sitting at home and you just feel like you just need something. Certainly if you're feeling suicidal or if somebody in your family is feeling suicidal. But I also wanted to share that there's some free or minimal cost therapy available for you. One of the interesting things is that people are probably familiar with Taraji P. Henson. Well, I don't know the circumstances that led her to do this, but she actually has set up a foundation in her father's name. It's called the Boris Lawrence Henson Foundation, and they're offering 5 free sessions to Black folks during the pandemic. And on the website, I'll put the link for that, but it's called the Boris Lawrence Henson Foundation. And Dr. Prater helped me find another resource. It's the Loveland Therapy Fund that Rachel Cargile has established. We also have a link for that, and they're actually offering some free therapy. I think they're booked up for the spring, but if you get on the list now, you can get on the list for the summer. So those, we'll put the links for those. And I also wanted to mention that there's something called Black Therapy Central. Now, this is not a therapy, but they have a program online called 10-Day Global Black Community Healing Service. And I've been hearing good things about it, that you can sign up for it. It's free, and you can go through this healing program at your own time. But it's a 10-day global Black community healing. And of course, it's virtual. So those are just some supports that are available to you during this time.
That is wonderful. Thank you so much, Dr. Burlew. I just want to remind everybody that all of those resources will be listed on COVID-19 communityresources.com. So we've got them. Dr. Burlew has already given them to us. We're going to have the final question from Kim Yamoyo. And I'm so glad you called in, Kim. When we started talking about Sankofa, I thought about you and the wonderful Sankofa program you had. So Sankofa just brought your name to mind, and now here you are. So it's great to hear from you. Okay, so Kimya's question, Kimya says, I'm concerned about what the future quote unquote normal may look like and the role that we the people can play in designing the quote new normal. I don't think it's healthy to return to the past, but that may mean that all of us in all disciplines and fields have roles to play. Really good point. Would anyone like to comment on that new normal?
Well, I'll attempt to add something to this conversation by saying I don't think any of us know what the new normal is going to look like, but I think one of the positives of having a reset like this is that it gives us an opportunity to step back and think about what we want to continue and what we want to change. And I think that's the part that we're at right now. Now that everything or a lot of things have been stripped away from us, to really think as a community about what are the things that we're missing and what are the things that we're doing us as a community or as individuals a disservice. And how can we work together collectively to make sure that we're only bringing back the things that are working towards our good. I think a lot of that is related to mental health and some of the topics that we've been talking about today. So we don't want to just think about our intimate relationships, our family relationships, or our relationships to work or our community during times of emergency like we're in right now. We want to make sure that moving forward, we give the same thought and attention to making sure that our relationship with all of these things in our circle are healthy. And I think it'll be a good community exercise to really think about what that means for the African-American community.
Thank you very much. You know, all of you have given us so much great information, a lot that we need to think about. Dr. G with your me time and we time, and you know, talking about the 7 principles of Kwanzaa and how we incorporate those into our lives, strengthening our families. All the information you have given us will help us not only survive, but thrive. We're going to move forward. We're going to be better individually and as families and as communities. And so thank you for all the work you're doing. I know you're working really hard every day, helping us get through this. And we really, really appreciate it. Dr. Kathy Burlew, I want to give you a special shout out because you organized this panel and you brought all of these fantastic people together. And so the information that you've given, thank you, the information you've given us will be on our website. I just want to make sure that everyone knows that we will be back next Saturday at 4 o'clock to have more information. And is there a poll? My daughter's giving me a note. There is a survey at the bottom of the screen. Is that right?
Yeah.
Okay, there's a survey at the bottom of the screen for all attendees. So please take a look at that. You'll be able to get that. We want to also wish everybody a happy Mother's Day tomorrow. Don't forget that. And just thank you for joining us today. Before we close, I would like to bring on Renee Mahaffey-Harris, who's President and CEO of the Center for Closing the Health Gap, and she will give us some final remarks. Thanks, everybody. Renee.
Hello, everyone. Thank you for our panelists. I really am very grateful for the Black Psychologists Association for all of the knowledge and expertise that you shared with us, and we look forward to posting all of the links and sharing all of the resources that you've provided, because that's really the key to us being able to address stress and all of the other factors that contribute to stress for our lives right now during these uncertain times. First of all, I want to thank our moderator, Jan Michelle Lemon-Kearney, our council member, and I also want to thank all of you. All of what we are doing here and really getting information out to our communities for us and by us happens because of our collaborators. Eddie Cohen, President and CEO of the Urban League of Greater Cincinnati and Southwest Ohio. Eric Kearney, who is the President and CEO of the African American Chamber of Commerce for Greater Cincinnati and Northern Kentucky. Both Robert Richardson and Joe Mallory, President and Vice President of the NAACP chapter of Greater Cincinnati. And I also want to really thank the Cincinnati Medical Association, who manage our Ask the Doctor feature on the COVID-19 communityresources.com site. So if you have any questions and any concerns that you're just not really quite sure where to go to COVID-19 communityresources.com and click on Ask the Doctor. I am just so grateful for all the partners. I've named the core partners, but there are more than 20 partnering organizations whose sites link through the COVID-19 communityresources.com site. And we are together making sure that we have all the information and knowledge we need to ensure that we are safe and healthy during this time. I wish all the mothers who are listening, all of the mothers on the panel today, happy Mother's Day. Happy Mother's Day to our moderator. And I again, thank you. We are in this together and we could not do what we are doing and sharing information without each of you listening and each of you who participated in today's panel. So I thank the panelists for the incredible information. Mental health is a big issue for us that we don't often talk about. So we are very grateful to have such expertise in our region. So thank you all.
Thank you, everybody. We'll see you next Saturday, 4 o'clock.